Good morning. Welcome to Contextual Media's ICD-9 Updates for 2009. My name is Susan Thurston. I am the Executive Director of Education for AHCAE, which is the Association of Healthcare Auditors and Educators, and I'm going to be your narrator today as we walk through the ICD-9 updates. The first thing that we're going to talk about is what is this thing about diagnostic coding, ICD-9 coding, and what do we need to know about ICD-9? The first thing that we know is that medical necessity is the reason that we have to know ICD-9, and we have to validate the type of services that are performed for the patient. What other things do they use ICD-9 for? Well, statistical data. It collects information about how our population, humans, are suffering from disease or they are dying from diseases. So it's a tracking mechanism for morbidity and also for mortality. Case mix at the hospital tells us what kind of services are provided to patients based on their diagnosis. And of course, the Catastrophic Coverage Act of 1988, when that went into effect, it made all of the industry in healthcare mandate that they utilized ICD-9 in the reporting of physician claims processes. Now, when we talk about payers and what they want when it comes to ICD-9, we know that there are several things that they need from us. One of them is the site of service, whether it is in the office, the hospital, or the emergency department. And the medical necessity or the appropriateness of the diagnostic or therapeutic service that's provided is validated by the appropriate and correct ICD-9 code. The services that have been provided have been accurately reported, and that's what the payers are looking for to make sure that that happens correctly. Why is ICD-9 coding so important? Well, keep in mind, ICD-9 represents the most comprehensive statistical classification system utilized today. We know that we've got ICD-10 on the forefront, and that's going to be coming up. But right now, ICD-9 is the way that we report our services for patients from a diagnostic perspective. That is the mechanism that the providers use that connect with CPT, or the current procedural terminology that's used for the type of service that the physician gives to the patient. Now let's talk about why that ICD-9 is so impactful on physician type of services. Number one, it justifies the type of care that's been given to the patient. It also presents or reports the appropriate facts relating to that event and to those services. Documentation requires signs, symptoms, complaints, or any other facts that help determine the reason of care for that patient. All facts always must be substantiated in the medical record. That record has to be available to requesting entities. What does that mean? That means that anytime a payer or a physician requests information about a patient, that we should be able to pull that medical record, make it available to whoever needs that information, and all the appropriate documentation for that ICD-9 or that diagnostic code will be found in the medical record. Now, this is the big guy that most of us have had an experience with, because medical necessity is the overarching criteria for any service that is done from a provider to validate that type of service. So what exactly is medical necessity? Let's take a look at it. A service that's reasonable and necessary for the diagnosis or treatment of illness or injury, or to improve the functioning of a malformed body member. Services must be consistent with the symptoms or diagnoses of the illness or injury that is under treatment. Necessary and consistent with generally accepted professional medical standards. That means not experimental or investigational in its nature. Not furnished primarily for the convenience of the patient, the attending physician, or another physician or supplier. That means it has to be driven by the need of the patient to see the physician at the time of that service. The service must be furnished at the most appropriate level, which can be provided safely and effectively to the patient. And that means that you can't use fluffy documentation to reach a level of service, nor can you use diagnosis codes that don't reflect the work that's being done for the patient on that particular occasion.